Welcome, class. This is lesson 3. We'll be covering chapter 4, which is all about anxiety. So I hope things are going well for you and that you're keeping up and you're checking on a syllabus for see when the assignments and the quizzes are due. Thank you very much for keeping up to date as much as possible. Dr. Hess here, and we're going to start our share on our PowerPoint right now. Here we go. So here's our learning objectives for today's chapter 4 lecture. We'll be talking about that fight or flight, or we now add freeze to that, fight, flight, or freeze that happens in our nervous system, mainly under the control of our limbic system and the amygdala in the center of our brain. We'll be talking about the different kinds of anxiety. We'll be talking about a little of the biological factors of anxiety and some of the treatments that are effective in treating anxiety disorders. So our textbook says anxiety is defined as an emotion characterized by physical symptoms that are future-oriented thoughts and escape or avoidance behaviors. So these are the 3 basic components of anxiety. That is that we can feel it in our bodies in certain kinds of ways. We are thinking about something that's going to happen in the future, which is what anxiety is all about. We're worried about something happening that might happen. And our bodies and our mind are trying to either avoid this future worry or escape from the situation as best we can. So again, our nervous system is set up with the central nervous system and the peripheral nervous system, which we talked about last week. We also have the somatic sensory system, which is throughout our bodies, which is how we can feel certain things. Neurons, there's somatic neurons that help us feel a sense of touch and such. Then we have the autonomic nervous system, which controls our heart rate, our lung capacity as far as breathing, all of the things that are under the control of the autonomic system, nervous system, happen without us actually thinking about it. That's the auto part of it. It's all of the things that are happening while we're sleeping, such as creating urine, processing our food, keeping our heart beating, breathing, keeping our blood pressure regulated. All of that is under the control of the autonomic nervous system. The two parts of the nervous system, the sympathetic and the parasympathetic nervous system, are important when we're talking about anxiety disorders, because the sympathetic nervous system, or the SNS, increases the heart rate and respiration and kind of gets our system revved up. And this is what happens a lot of times when we have those future-oriented thoughts and we're worrying about certain things. The sympathetic nervous system will start to get ready to either fight or flight. We might freeze also too. This getting ready is brought to us by the sympathetic nervous system. The parasympathetic nervous system is the opposite of that, and that is the one that slows everything down. And it's there to, after we have somehow maybe stopped worrying about it, the parasympathetic will bring all of our heart rate, our blood pressure, our breathing rate, all down to the normal level that we normally feel. We won't be so revved up. When we're talking about anxiety disorders, oftentimes we think of anxiety as something that's bad. It really isn't. The fight or flight system that our brains have developed are really there to help keep us alive. It helps us to recognize danger and decide what we should do about it. And so all anxiety is not bad. It's important that we have a little bit of anxiety going at all times. Otherwise, we would step out in front of a bus, or we would not pay attention while we're driving. When anxiety becomes something that's happening all the time and is starting to cause us to have problems with functioning in our life, like going to school or going to work or in our relationships, that's when anxiety becomes a disorder. Some of the physiological responses that people report when they're anxious is this increased in heart rate. Sometimes they'll have palpitations. They'll feel a shortness of breath. They'll start to usually only use the top 25% of their lung. They're short of breath. Oftentimes talk about being sweaty. We can get dizzy. There'll be a buzzing or a ringing in the ear. We'll have muscle tension. Some of us will get irritable. After a while, all of this tension and everything will lead us to be feeling tired. It also can cause some gastrointestinal distress. A lot of people, sometimes when we're doing our first speech in a speech class or whatever, we'll feel sick to our stomach, or we might have some diarrhea or whatever. This is that gastrointestinal distress that happens when we are highly anxious. Over the development, psychological development of humans, we see that the fears change as we go along. During infancy, it's really important that we keep in contact with our caregivers, and so that they can give us some support physically, and we have a fear of falling over. 1 to 2 year olds we have stranger anxiety. At 3 to 5, where some of us are going to be afraid of the dark. At 6 to 9, we have some of us that are fearing school and all the new things that are brought to us in the classroom, and the new teacher and things we have to do there. 9 to 12, we have test anxiety coming up for us. And for some of us, that never leaves us. And 13 and older, social interaction and kind of peer interactions is what most people say is causing them anxiety. So here's a list of some of the anxiety disorders. The top one, probably the most distressful anxiety disorder, is a panic attack, which really feels like the people report that they feel that they're either having a heart attack or they're going to die, they're going to act crazy, something's going to happen. We have panic disorder, agoraphobia, generalized anxiety disorder, or GAD, social anxiety disorder, selective mutism. Specific phobias are in here too, where we're afraid of spiders or afraid of fire. And we have separation anxiety disorder, which happens for mainly children, but some adults have this also. As I reported before, a lot of people end up in the emergency department or the ER with feeling that they are going to die. They've called 911s because they get there, they find out they haven't had a heart attack or are having a heart attack, but are having a panic attack. And then are referred to counselors to be able to do that. So as I go through some of these slides rather rapidly, and here's my cat, say hi. I had to have some comments that last week I went through some of the slides rather rapidly. Please use the pause in that so that you could read those things. I'm not going to be talking about every slide, but you can use the pause, or in the content after this lecture is also something called the textbook PowerPoint for the chapter. And in there, you'll be able to scroll through those one by one and read them if you want, but feel free to pause this video lecture at any time. Agoraphobia is basically an intense fear and anxiety that happens when we have to go outside of the boundaries that make us feel safe. A lot of people will have agoraphobia and they are not able to leave their house or leave a specific room in their house. They're afraid that they're going to have some kind of embarrassing symptoms out there. These symptoms change across cultures often and can lead to depression because we're not able to do the things that we would like to do. Generalized anxiety disorder is reported in a lot of people that come to counseling. These people, they're suffering from feeling anxious in a lot of different situations. So there's no specific situation such as giving a speech or driving a car or whatever that causes them. They are just anxious a lot. And the DSM-5, that diagnostic manual that we talked about last week, says that it has to happen for this consistently over 6 months, and we have to have physical and cognitive symptoms. Social anxiety disorder is when people are specifically anxious and it causes them to have dysfunction when they're around other people, such as speaking or eating in front of people, drinking in front of people, or writing in the presence of others. This oftentimes, when it causes us to not be able to do these things, can become a disorder and require treatment. A lot of people are interested in specific phobias. So there's fear of spiders, fear of snakes, fear of fire, fear of you name it. There's all kinds of them. They'll have somewhat interesting names that you can look up in Google if you wish. There's a lot of different things. And so whenever we are in the presence of whatever our phobia is, whatever we're afraid of, we will have a lot of anxiety, probably more than the average person, and it's causing us not to be able to function in our life. Separation anxiety disorder is when we are not able to make connection with the people that we feel safe with, usually some kind of either primary caregiver or someone that we have bonded with. In life. Happens a lot during childhood, but again, as I pointed out earlier, that some adults have separation anxiety disorder. This is primarily in pre-adolescent children, school age things, those of us that were anxious and didn't really want to leave mom, grandma, aunt, whoever dropped us off at kindergarten. It can be a problem for us. So here's a big anxiety disorder thing that's been pretty popular for the last maybe 25 years or so, post-traumatic stress disorder. It is, textbook says it's intense psychological and physiological reaction to events or situations that symbolize or represent a previously experienced traumatic event. In other words, if you're in a car accident, being around cars or driving can oftentimes bring on an intensive re-experiencing almost of the trauma that happened when you had the car accident. This is, a lot of us will have some kind of PTSD, and there is a lot of comorbidity. In other words, another disorder that we have at this can happen at any age, and usually it follows some big traumatic event that the person can identify. Here's some of the classic symptoms associated with PTSD or post-traumatic stress disorder. This re-experiencing of the trauma, in other words, it just happens. You start to think like you're there again. You can see images in your mind of what's happening. It affects our mood and our ability to think. We tend to be oftentimes when we're doing this have a hyperarousal. In other words, we are looking around to make sure to keep ourselves safe. Again, there's a hypervigilance that is also there. There's an exaggerated startle response. So if loud noises can often send you diving under your desk or running out of the room, and can cause some avoidance of specific situations or objects associated with the trauma. The research shows us that anxiety disorders generally run in families, and so if in your family there are people who have anxiety disorders, there's probably going to be some issues that you might have with this disorder. So how does this all happen? What is the theory behind it? From the psychodynamic or Freudian theories, we believe that fear is acquired um, be because of a conflict we have in our mind between the id and the ego. Um, the id is that young part of us that is looking for immediate gratification, doesn't like kind of rules and stuff like that, where ego is basically the part of us that is trying to function in the world as an adult. When those two are in opposition, in other words, those two parts of our mind want different things, we can become anxious and use defense mechanisms, as Freud told us that, about repression and displacement along with others. In the behavioral theory, so Watson and Skinner are theorists there. We've learned this to have fear and anxiety through classical conditioning, and the anxiety disorders develop out of this learned experience. Cognitive theories, such as Aaron Beck, will be explaining anxiety through somewhat of an accurate interpretation of what's happening so it's a misinterpretation that needs to be straightened out. We are using some kind of maladaptive thinking and develop that over time, and our minds slowly accept this mistake in thinking and then continue to have a rational fear of spiders or whatever as we're going along. Some of the biological treatments for anxiety disorder, oftentimes medication helps. Some of the antidepressant medications, the SSRIs, the selective serotonin reuptake inhibitors, have side effects that are calming to our system. The specific benzodiazepines are like Valium and Xanax, are prescribed by psychiatrists and doctors, family doctors, to help calm people down once they have started this kind of cycle and the symptoms of physiological and mental anxiety. There's a lot of other things here listed at the bottom that we can try, but mainly medications are going to work along with psychological treatments. Some kind of counseling is always indicated when you're on a psychotropic medication, something that's helping you with anxiety. There's lots of different ones that we're listing here. Probably the most common used is some CBT or cognitive behavioral therapy here. By most counselors that I talk to are using CBT to treat anxiety disorders. The exposure exposure treatments are also kind of used a lot, and this is where we would slowly introduce your fear, mainly in small steps, like walking closely and talking about spiders, and then maybe watching pictures of spiders, and then maybe watching a video of a spider, and then bringing a spider in a jar, to this therapy session and then actually having the spider crawl on your hand, this kind of exposure can be helpful in the presence of someone who's skilled in this. Mindfulness exercises, kind of meditation kinds of things, practices are also helpful in calming the brain, being able to take a moment to be able to understand what's happening and not go down that anxiety trail so that you end up with some kind of panic attack or anxiety disorder. Virtual reality is used quite a bit with PTSD, where people will use headsets to put themselves in these kind of exposure ways in a safe way, so they can be, their mind can feel like they are driving when they're really not, and be able to deal with, in the presence of a counselor, be able to deal with the feelings that come up. So that brings us to the end of our time together on our chapter this week. I'm going to stop the share. And again, thank you for being with me, and I will see you next week. Bye for now.